to welcome Stephen. So Stephen, how did you get involved with these fit-looking blokes?
Well, okay, well I'll start from the beginning. I'm bipolar. Oh, you're about 2-3 years ago, I was sort of off my 10th episode in hospital. Kind of hit me homeless for about, 4 months, just got housing. And my psych said, well, there's a program called Brightside. At the time, I was about 110 kilos due to meds and other factors, being depressed, not doing anything, staying at home. And he said, well, it's free. You can go for 2 months. They'll give you a program. They'll help you out. It's 5 minutes from your house. So I really didn't have any excuses. So I started going. It actually, at the time, when you're depressed, you don't like talking to anybody, anything. I had a bad leg because I torn my ACL. But I went there. Jenny, the lady that was in charge of the Brightside program at the time, was really helpful, gave me a program. At first, you sort of don't talk to anybody for the first week, but then you get to know people. It becomes a bit of a community. By the end of sort of 2 months, I could see results. And at the moment, I'm actually doing sort of Cert 3 and Cert 4 in fitness. To actually
give him a clap.
And it's been really helpful. It was a big jump start, and I was able to go back to Thorpe to do my internship and stuff like that.
Okay. How has it changed your life that you got involved in this?
Well, one, it got me back to a level of fitness. It was able to help me actually reduce my meds because I didn't need so many, because you actually sort of feel better when you go. Yeah, it just gave me a kickstart. My partner noticed that there was a huge difference after I started going to the gym from before I actually got semi-motivated and started getting on with life.
And also you mentioned that you feel like you've met more people.
Yeah, because the gym is a community. Before that, I just stay home. You're happy staying within your 4 walls, it feels safe. But being forced to go out, you meet people. They ask you for a spot. You see the same people because you go at the same time every night. And they start talking to you. By the time you leave, you've got, in about 4 weeks, you've got at least 4 or 5 friends to say hi. You talk about the weekend, what you did.
Yeah.
So.
And how are you maintaining the fitness that you've gained and the well-being you've gained?
Okay, how am I maintaining it? Well, I've actually kind of moved past the weights in Thorpe now. I go to a 24-hour gym just because I like to work out at odd hours, like 11 p.m. at night. However, Thorpe, as I said, was really helpful. They let me come back there to do my internship. It's a lot bigger than the gym that I go to in terms of people and stuff like that. So you get to see more things, do more machines. But without it, I probably would not have gotten started in the first place.
Golly, it's great to hear your story. Would you give him a warm round of applause? Introduce yourself again and tell us about your role in this project.
I've been involved with the YMCA for a number of years now, and the Brightside program is the brainchild of Adam Waterston, who has moved on from the Y now, unfortunately, and I'm now the program leader of the program across the YMCA of Sydney. We started in 9 fitness centres and now up to 11 running the program that allows individuals 60 days membership to the health club and all access to whatever facilities they may have, be it pools, gyms, competitions, all that sort of stuff.
So to be into this, you have to have a mental illness?
Yeah, you do. The program is aimed at individuals in prodromal or remission phases of mental illness, so it isn't for everyone, but definitely for individuals that are showing signs of early mental illness or on their way out and showing some sort of recovery, and as Steve spoke about really well, it's that great kickstart you need to get back into society and start mingling with people again and make new friends, and so that's who it's aimed at.
And have you worked with Steve?
Did I work with Steve? Yeah, absolutely. Yeah, we saw Steve. He was one of our best individuals across the whole program, across all 11 sites. I believe in 60 days he had 42 visits. So,
and he was surprised. He didn't know numbers were big. You only heard your score in this room, didn't you?
Yeah.
They've got performance indicators. And why do you think you were so effective at getting involved?
Okay, back when I was in uni, I used to play state basketball and stuff. So I kind of used to go to the gym. I just kind of had lost my way for about 3-4 years.
Okay.
So I guess it was also something I could latch onto in a way.
Yes.
I mean, I used to enjoy going to the gym. Once I started going, it's next to the house, the partner would kick me at the house, I was trying to go to the gym, so off I go, trying to push my weights on the treadmill, go swimming, whatever. So, yeah, you just find something that you love to do, and I actually love going to the gym.
It just strikes me that how important it is to really get to know people you're working with. Like, I'm involved in a fitness group, I might hear a bit about it in a moment. And it's amazing the number of women, it's a women's walking group in it, who at some point in their life have done something active. And sometimes it's 30 or 40 years earlier. But I was just thinking, if I was working with someone and wanting to help them get physically well, finding out if there was ever a time they enjoyed anything, you know what I mean? There's some sort of neural memory. I mean, you're involved with all your sorts of people. What normally gets people motivated and to sustain their motivation?
Everyone in this room has a reason why they want to exercise, and it doesn't have to be vanity, it doesn't have to be your dress size or your belt size, it's, excuse me, it could be to be able to run around the kids for 10 minutes longer than you can now, or to get up and not feel pain in your back, or be able to walk because your knees don't feel dodgy, or there's a million and one different reasons why people want to do it, and when they find that that's improving and heading towards that goal, you can't stop them.
Thank you, thank you. Now, can I just meet this gentleman and then I'll come to you. Do you want to introduce yourself and explain your role?
Yeah, my role is similar to Rob's. I manage the health club at Callan Park Aquatic Fitness Centre. So we're just up the road there near St Mary's Cathedral, and similar to Rob, we have the Brightside program there. So it's been pretty successful at our club also.
Tell us, you've been sitting in this morning and you don't normally come to events all about mental health. What have you learned today? What have been the impressions that will stay with you?
Well, it's actually been good timing to have us come, I guess, at the end, because we're one of the programs linking, physical health and fitness with mental health. So it's been great, and I think one of the things I've taken away is, looking at some of the partnerships we've developed with some of you guys out there today. So how it works at the moment is we actually get a referral from a health professional. So if you've got a YMCA in your area, come and see us. Chances are we'll have Brightside running there. So yeah.
Sometimes there's stigma associated with people with a mental illness. You're obviously a mainstream health club. Have there been any sensitivities, or how's it gone?
Well, like any other member, they are entitled to come in and getting initial one-on-one consult with our staff. Our staff have all been through some sort of training, so we have a pretty comprehensive training program for Brightside staff, and they go through we go through a consultation process there, and then they come in and meet with the trainer quite regularly. We try to integrate the guys that are involved in Brightside into all our facilities of the health club. So that could be group fitness classes, gym classes, swimming classes, aqua fitness, things like that. We don't see them any differently to any other member of our club. And there's definitely, none of the other guys that work there have any stigma attached to it. We actually think it's one of our most successful programs. So.
It's sort of thrilling, isn't it? Because it's mainstream. Sir, Terry is from Mental Health Association of New South Wales. How did you get involved, and what would you like to say about the project?
Okay, well, I joined the Mental Health Association. I'm a psychologist earlier this year. And when I went down to the gym, because I've had a lifelong commitment to exercise and training coming from a sporting background as a youngster, I saw the program. And then I thought, well, we need to partner with these guys to support them and provide and share whatever resources and information we can around mental health, not only for the staff in the gyms that are running the programs, but also for any of the consumers that might be involved in the program. So we're there to help and support them in any way that we can, and to provide some seminars and workshops for the staff involved in the program.
And tell us the story. He has a memory from childhood that is very powerful.
All right, this goes back to the mid-60s when I was a very young boy. At that stage we had a lot of psychiatric hospitals and they were full. Now my dad was an electrician at Callan Park, and on Thursday nights he used to run the pictures there. They had new release movies every week. So as a young boy this was great for me. I used to go with Dad, And it was really terrific because I was young and I wasn't impacted by stigma or any of those things at that stage. And it was a real treat for a lot of the patients there. And they'd save a seat for me out the front. And you know, it was just a wonderful experience. But I realised, you know, their behaviour was strange. And looking back, and when I started at uni in the 70s, I realised what was happening there. They were all being medicated to control behaviour. You know, it had nothing to do with healing, and it had nothing to do with bringing them back to health. It was just control and manage that behaviour. And here we are now, several decades later, and I don't think we've come all that far with this. You know, still largely we use medication to control behaviour, and it does a good job of doing that. And I know it's very difficult sometimes for carers and for family members, and that's a real outlet, but I think it shows a real flaw in the system. And as we've seen, there's been a lot of work by Black Dog looking at the impact of physical activity on some of the high prevalence disorders, the anxieties and the depression. And it's a very positive link there that can often reduce the medication altogether, or certainly reduce it. And there's some interesting work now that's coming out of Europe.
Not scary.
But it's looking at the impact on those the more low prevalence disorders, the psychosis and schizophrenias, and that they're finding really similar results. So I think this is something we really need to look at, and we need to bring together a holistic approach to how we start dealing with mental illness, instead of just, you know, chopping off the head. There's mental illness, and here's your body, here's your physical.
So treat for health, not control.
Oh, look, for sure. And you know, just from my background and through exercise, I've found that not only does it help control your mood, but it actually lifts your mood. And that period after exercise, it's a great feeling, and that's what keeps me going back. And I enjoy exercising early in the morning, knowing that most people my age are still in bed and not wanting to do it. But also through sport, I learned how to control arousal, I learned how to control anxiety, and all sorts of things. I think that...
You'd think by 57 I could keep a straight face when someone says arousal.
I didn't learn that sort of thing.